Okay, so first we're gonna start palpating your hallux, starting off with your first metatarsal phalangeal joint here, and then more distally is your interphalangeal joint, which is here. And these two joints together can perform flexion and extension. Next, we're gonna be performing a palpation on your gastrocnemius, starting at your popliteal area. Here is gonna form the two tendons of the gastroc. And then I'm going to ask my patient to perform calf raises here and then down. Next, we're going to be palpating your vastus medialis, which is the most medial side of your quadriceps. So I'm going to ask my patient to fully extend his knee, palpating here to see the teardrop. And it runs all the way down to the patellar tendon. Next, we're going to be palpating your calcaneus, which is also attached to your calcaneal tendon, which is also known as your Achilles tendon. So you can start there and then move down distally. Or you can start from your medial or lateral malleoli and then move distally down to feel the calcaneus. Now we're going to assess the anterior tibiofibular joint, starting at your lateral malleoli, moving up and over. So we're going to start at a neutral position of your ankle. We're going to put the fulcrum on your lateral malleoli, lining this one up with your fifth metatarsal, and this up with the head of your tibia. Okay. And then we're going to perform plantar flexion down. Okay. And we are at about 40 degrees. Inversion, putting the fulcrum in the middle between the lateral and medial malleoli, lining up the stationary arm with your tibia, the shaft of your tibia, pointing the moving arm to your second metatarsal, and then the patient is going to complete eversion. So, all right. 25? Yep. Okay, now I'm gonna be assessing the range of motion for knee extension. We're gonna put the fulcrum on your lateral femoral condyle, which is here. The stationary arm points towards the greater trochanter, and then the moving arm points towards your lateral malleoli. And I'm gonna ask the patient to slowly perform knee flexion. Go ahead. Okay. Okay. And we're at about 120 degrees. We're gonna conduct manual muscle testing for the tibialis anterior, asking the patient to dorsiflex and then evert their foot. And I'm gonna ask them to hold and resist, going down and out, and they're not budging. So that is a grade 5 out of 5 for. Okay, now we're gonna assess the peroneal longus. I'm gonna ask my patient to plantar flex and then evert out, and then here. And I'm gonna do the opposite motion and see if they can resist that. And that's a 5 out of 5.